Now for the next up, what we are going to discuss next is candidiasis. But here we're just trying to look at one aspect of candidiasis, which is the clinical features of it. So clinical features of candidiasis. Of course, candidiasis is a yeast infection. So for what we have here on the clinical features, it's also known as yeast infection, right? So it's caused, this is just introduction, it's caused by what? A type of yeast, mostly the candida what? Albicans. So the features vary. This is depending on how long the infection has been with you and if your immune system is able to tolerate it very well or not. Do you understand? Some people have yeast infection and there's no issues. So clinical features. So sometimes it comes up with intense itching and irritation in the vagina. So the patient can be discharging vaginal discharge is whitish, known as a cottage cheese. Sometimes there's redness and swelling on the outside of the vagina, that's a vulva. Sometimes there's pain when they try to have sex, okay, or urinate. So you can also have yeast infection in the mouth, okay. So you want to ask me why? Okay, some people actually they practice oral sex, so it can move from the reproductive system to the mouth, you know. So oral one, you have white patches on the tongue, the inner cheeks or the roof of the mouth. Okay, there's redness and soreness. The mouth is, your whole oral cavity is paining you. Okay, so difficulty swallowing because the infection cannot be going down to the throat. Cracking on the corners of the mouth, that's angular cheilitis. So cutaneous candidiasis, that one now is infection on the skin. Sometimes your partner just want to discharge on you. Do you understand? So the infection can actually be spreading to the skin. So red itchy rashes in the skin folds, satellite lesions, then your skin is moist and macerated. So invasive, sometimes the candidiasis is now spreading into the system. You have fever and chills, then of course sepsis is coming up. Okay, then can affect different organs. So the symptoms now is depending on which organ was actually affected in the systemic candidiasis.